teacher here in District 10. I work for an intermediate unit, so we represent about 4 different counties, most of which are within this congressional district. In general, most of us, I would say, probably view saving money as a good thing. We look through our budgets each month or every quarter or whenever we think about our budgets and look for ways that we can kind of pull back on unnecessary things. Well, as my counterpart Carol said, Medicaid is not an unnecessary thing. A lot of people think about Medicaid and Medicare as health care, and that's true, but they don't necessarily think about all of the impacts that those programs have. In education specifically, but also in healthcare, when you cut costs, you're just kicking the can further down the line. Those problems don't go away. In fact, they get worse, and they get worse over time. So when you cut costs and you don't give a student or a person glasses, their vision continues to degenerate. They might need surgery in the future. And that can be said about just about any kind of medical condition. Dental health impacts your entire body, is something that I learned in the past couple of years. And so this is not going to save us anything. It's just going to cost society, and more than likely the states, more money in the future. When they talk about local control, when they talk about giving the rights back to the states, what they're really talking about is giving the financial burden back to the states. And that's not going to be helpful for any of us. It's going to be particularly harmful for those rural communities that are already so close to that borderline of poverty. I work in emotional support, so I see the effect of early intervention, and I see that students that receive services earlier have smaller problems. They learn to control their anxiety, to control their anger, to express those in appropriate and effective ways. Some of that through social work, through counseling services, through other psychiatric care, are funded through Medicaid. We don't want to play catch up on those kind of issues, because those are the things that result in homelessness, in addiction, in breaking up families through violence and abuse. Those are not things that we can afford to cut. And so it's very important that we understand the number of people that are impacted. It's not just a couple of poor people down the corner. It is 37 million children across the country. That's glasses, that's dental care, that's vaccines, that's preventative care, that's physicals. That's just the typically developing children. Then you can get into the counseling, mental, behavioral health services, crisis services, occupational therapy and physical therapy, as Carol mentioned, medication management, specialized equipment. We want our children and our adults to be able to communicate in whatever way is most effective for them. Those speech-to-text devices, those picture exchange systems, a lot of those are also covered through Medicaid funds. So it's about time that we stop looking at healthcare and education as businesses, because when you put in less income, you don't get better outcomes. You just have to pay for those out of your own pocket as an adult later on. There's a fallacy going on that some students don't deserve an education. And this is one step closer to that direction. So if you care about anybody in the public schools, if you care about anybody in the country, then you need to understand that this is exceptionally harmful. And chant it with me. Hands off our Medicaid. Thank you. All right.